Welcome everyone to today's video, where we'll be showcasing the transformation journeys of multiple patients. So, let's begin with the journeys of our first patient and see how their hair transplant surgery transformed their appearance, restored their hairlines, and boosted their confidence.
Hello viewers, today we are going to share the 11-month journey of our patient who was facing the challenges of diffuse grade 6 baldness. This advanced stage of baldness led to a receded hairline, making the frontal area a bit sparse and severely thinned the remaining. Along with it, the mid-scalp and crown region have also become thin, making him look older than his actual age. To add more complexity to his case, his donor area appeared in an average condition. But when you are in expert hands, then there is no need to worry. After a thorough scalp examination, our experts crafted a custom-shaped hairline according to his facial features, keeping the hairline slightly lower in the middle and at a precise distance of 7 cm from the glabella point. Along with the hairline, the entire affected area was outlined with the markings of the required density. This approach leads to a comprehensive outcome. During the procedure, our experts implanted single and thin hair follicles in the hairline zone to create a natural and soft look, as hairline can make or break one's appearance and also bring back one's youthful look. In the frontal area and mid-scalp, double and triple hair follicles were implanted, providing a more voluminous look in comparison to the mid-scalp. In the crown region, the same follicles were implanted at varying angles to volumize the natural-looking swirl pattern. In this case, a total of 4,500 grafts were implanted, all extracted from the patient's safe donor zone. One-month post-transplant, when our patient visited the clinic for his follow-up PRP session, our experts noticed 60% shedding in the transplanted area, which is completely normal at this stage. The redness visible in the transplanted and donor area is due to the surgical implantation of grafts. This is a positive sign that his scalp was healing well. Meanwhile, the native follicles were growing at their natural pace. Two months post-transplant, almost all the follicles had shed and native follicles were growing maturely, which is why in this early stage slight growth was visible on his scalp. Five months post-transplant, the progress was noteworthy. His hairline began to take shape and beautifully framing his facial features. From the front, the hairline was creating an illusion of dense hair growth, but there were still some gaps visible in the frontal area and mid-scalp, as transplanted follicles were integrating with the native ones. These gaps can be filled in the coming months, and we would see a good growth in the frontal area and mid-scalp. 11 months post-transplant, the results were amazing. His hairline was perfectly framing his facial features and bringing back his youthful appearance. The frontal area and mid-scalp have gained voluminous growth with the seamless merge of transplanted and native hairs. The patient's entire appearance had noticeably changed in this period. The crown region was also replicating a perfect swirl, adding fullness to the overall scalp. The transplant results not only stood the test of time, but also gave the patient the freedom to style his hair as he wished, without any limitations. If you are inspired by the patient's journey and also want your lost confidence and youthful look back, then right now book a consultation with our experts.
Now let's move on to the next patient and take a look at their hair transplant journeys from surgery to final results.
Hello viewers, today we are going to share the journey of a 28-year-old patient who was confronting the challenges of diffuse grade 4 hair baldness. His hairline completely receded and changed into an M shape. Along with this, significant thinning was visible in the frontal area and mid-scalp. The crown region retained a swirl pattern with less density. Fortunately, he had a good donor area full of healthy hair follicles. Stay tuned for amazing results. After thoroughly examining the scalp, our experts designed a custom-shaped hairline that suited the patient's facial features. The goal was to create a natural look, so the hairline was positioned slightly lower in the center, exactly 7 cm from the glabella point. This positioning helped achieve a balanced appearance, and the areas of thinning on the scalp were marked for grafting. During the procedure, our experts implanted single and thin hair follicles in the hairline zone to create a natural look and gain the desired density. In the frontal area and mid-scalp, double and triple hair follicles were implanted to create a natural look, while the frontal tuft was retained as it already had healthy hair follicles. In the crown region, to add density in a natural looking whirl, same follicles were implanted at varying angles. In this case, a total of 4,500 grafts were implanted, all extracted from the patient's safe donor zone and beard area. One month after the hair transplant, the patient returned to the clinic for his follow-up PRP session. During the visit, our experts noticed that approximately 70% of the transplanted hair had shed. This shedding is a normal part of the hair growth cycle following a transplant. Initially, the transplanted hairs fall out, but over time, new mature hair starts to grow in their place. By this time, his donor and beard areas both were completely healed. 4 months after the transplant, the patient returned for his follow-up PRP session. At this stage, hair growth had begun and the transplanted hairs were starting to blend with the native hairs. The crown area had also healed, showing significant improvement. In the upcoming months, we expect to see even better results as the growth continues. 5 months after the transplant, the patient's hairline had perfectly framed the face and significant growth had been observed in the frontal and mid-scalp areas. Although some thinning remained, the crown area had begun to show a swirl pattern. Growth in this region was still developing, and it was expected that further progress would become visible in the upcoming months. After 9 months, the results were nothing short of remarkable. The hairline had been expertly defined, perfectly framing the patient's facial structure. The frontal and mid-scalp areas had achieved impressive density, blending seamlessly with the natural hair for a flawless look. The crown had developed a natural swirl pattern, enhancing the overall aesthetic. Now, he enjoys the freedom to experiment with various haircuts and styles, a choice previously limited by baldness. The comprehensive results at this stage underscored the enduring impact of the transplant, affirming the patient's newfound confidence and rejuvenated quality of life.
Now let's move on to the next patient and take a look at their hair transplant journeys from surgery to final results.
Hello everyone, today we are excited to share the transformation journey of a 25-year-old patient who faced the challenges of diffuse grade 4 baldness. This condition led to a noticeable receding hairline forming a distinct M-shaped pattern, causing significant sparseness along the sides of the frontal area. While the remaining frontal area has healthy growth, the mid-scalp was affected by the thinning and the crown region experienced a reduction in hair density, with a fine swirl but less volume around it. Thankfully, our patient had a robust donor area, rich in healthy follicles, which played a pivotal role in the transplant success. Our experts crafted a custom-shaped hairline according to the patient's facial features. The hairline was crafted with precision, positioned slightly lower in the center, and measured at an exact distance of 7 cm from the glabella point, ensuring a natural appearance. In addition to the hairline, the sides of the frontal area were also outlined, and the affected area of the mid-scalp and crown region was encircled. This comprehensive approach allowed us to achieve balanced and seamless results for the patient. During the procedure, our experts implanted single and thin hair follicles in the hairline zone to create a natural look and avoid a pluggy appearance, as this area frames one's facial structure. In the sparse sides of the frontal area, double and triple hair follicles were implanted to create a fuller look by providing high density. For the mid-scalp, same follicles were implanted to add volume, and in the crown region, double and triple hair follicles were strategically implanted at different angles to enhance volume and complete the swirl pattern. In total, 3,800 grafts were implanted, all extracted from the patient's dense and safe donor zone. Eight months post-transplant, the results were noteworthy as his hairline looked defined and perfectly framed his facial structure. The affected frontal area and mid-scalp have achieved the desired density with the seamless merge of transplanted and native hairs. The swirl pattern in the crown region became perfect and the volume was enhanced. In just 8 months, the patient's appearance was revitalized and significantly improved. This transformation not only boosted his confidence but also showcased our experts' efficient approach to his hair restoration. These results showcase that hair transplants can change your appearance. If you are inspired by this patient's journey, book a consultation with our experts right now. And don't forget to like, share and subscribe. Thank you for watching our video.
Now let's move on to the next patient and take a look at their hair transplant journeys from surgery to final results.
Today we will share the journey of our patient who was grappling with the challenges of diffuse grade 6 baldness, which caused a receded hairline in an M shape, due to which his frontal area became sparse from the sides and thinned from the frontal tuft. Mid-scalp and crown regions were also severely affected by the thinning. All these conditions made him look older than his actual age. Fortunately, he had a good donor area which provided the healthy follicles needed for a successful transplant. Our team meticulously extracted and implanted each follicle, ensuring the best possible outcome. When he visited the clinic, our experts examined his scalp with a keen eye and then made a treatment plan for him. We trimmed the rest of the hair because advanced grade baldness surgeries are performed after trimming of hair. After the hair trim session, we did his head wash and then our experts crafted a custom shaped hairline for him according to his facial features, keeping it at the precise distance of 7.1 cm from the glabella point. Along with the hairline, other affected areas were also marked. The marking was to the crown for a comprehensive approach. During the procedure, our experts implanted single and thin hair follicles in the hairline zone to create a natural look and avoid a pluggy appearance of the hairline. To add volume and density in the frontal area and mid-scalp, double and triple hair follicles were implanted. The same follicles were opted for the crown region but implanted at different angles to create a natural looking swirl pattern. In this case, a total of 5,500 grafts were implanted, all extracted from the patient's safe donor zone and beard area. "12 months post-transplant, results were amazing, as the hairline was completely defined and was perfectly framing the patient's facial frames. The frontal area and mid-scalp have gained light blockage density, and follicles at the crown region were growing maturely and creating a natural-looking swirl pattern. If we compare the patient's look with his initial condition, it has completely reversed. Now, he is satisfied and happy with his results, as these results made him look young and energetic once again. If you want to regain your youthful appearance, book a consultation with our experts today. We will continue to share the patient's results in the upcoming months.
Now let's move on to the next patient and take a look at their hair transplant journeys from surgery to final results.
Hello viewers, Welcome to the official YouTube channel of QHT Clinic. In this video, we are going to share the 7 months progress of our patient who was confronting the challenges of diffuse grade 5A baldness. This advanced stage of baldness led to a vanished hairline with sparseness in the frontal area. The mid-scalp has become severely thinned and the crown region was also affected by the thinning. What makes his case more complicated is his average donor area. But no need to worry as far as you are in the QHT Clinic's expert hands. Let's see how our experts tackle this case and give him his youthful look back. After a thorough scalp examination, our experts crafted a custom-shaped hairline in perfect harmony with the patient's facial structure. Keeping the hairline slightly lower from the middle and at the precise distance of 7.1 cm from the glabella point. Along with the hairline, temples were also designed with precision and perfect angulation. The creation of an acute frontotemporal angle is planned and carried out with complete care so that one does not feel a difference between the hairline and temples. These details were considered while designing to achieve results that were both natural and aesthetically pleasing. During the procedure, our experts implanted single and thin hair follicles in the hairline zone and temples to create a natural and soft look. In the frontal area and mid-scalp to add volume and density, double and triple hair follicles were implanted, creating a fuller look. In this case, a total of 5,850 grafts were implanted, all extracted from the patient's safe donor zone and beard area, ensuring the health and longevity of the transplanted follicles. One month after the hair transplant, the patient visited the clinic for his follow-up PRP session, a pivotal part of the post-transplant care aimed to stimulate hair growth. At this stage, our experts observed around 80% shedding in the transplanted regions, a normal and expected part of the hair growth cycle. Three months post-transplant, the shedding phase was concluding and follicles were successfully transitioning into the growth phase. You could see new growth, especially in the frontal area and mid-scalp. Though it wasn't super thick just yet, this is still an early stage in the process. It's normal for the volume to be a bit lighter at this point, as the hair is just beginning to come in. Seven months post-transplant, the progress was outstanding. His hairline and temples were looking defined and perfectly framing his facial features. The frontal area and mid-scalp have gained voluminous growth with the seamless merger of transplanted and native hair. The crown still shows thinning as it was left for a second hair transplant session. The most area of his scalp was full of lush, voluminous hair growth, which has completely transformed his look. This progress not only transformed his appearance, but also elevated his confidence, giving him a renewed sense of self-assurance. The journey is truly impressive, and we look forward to seeing the continued evolution of his hair restoration.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.